When I started out as a graduate student 25 years ago, there were no effective treatments for post-traumatic stress disorder. I've had the good fortune of doing clinical research over the last 20 years and helping to develop effective treatments for post-traumatic stress disorder.
Our program relies on evidence-based treatments, and specifically exposure therapy. And people might have heard of the term exposure therapy, but not be really clear on what it is. The idea of exposure therapy is in a structured and therapeutic manner, helping the individual confront the situations and the memories that cause distress so that they can gain mastery over them.
We've pioneered new treatments for post-traumatic stress here at New York-Presbyterian. One of them is virtual reality-based therapy. It takes the same theory of learning that exposure therapy is based on and augments it. So instead of a patient coming in and talking about their memory, we're adding in sensory elements. And what we think that does is we think that allows them to just engage more fully with their memory and get around the avoidance. It's natural to avoid what you fear. And it's very hard to come in treatment and talk about your memory. But if you see what happened again and you smell it and you feel like you're back there, we think that engages a patient more easily and will just make treatment easier, and therefore go more quickly and be effective. Our memories are sensory rich, and so when we come back from our trauma, no matter where we were in the world, we bring our memory with us. And so if you were at the World Trade Center and you were walking down the stairs and you were terrified that you might not survive and you'd never get home to your family, you probably have a conditioned fear response to stairs, to tall buildings, to airplanes. That is a classically conditioned response. There is a neutral stimuli, an airplane. It's now associated with fear because of the World Trade Center attack. What happens with post-traumatic stress disorder, though, is that the experience isn't formed as a memory. It comes back to us in flashbacks, nightmares. If you're having difficulty sleeping, or you're feeling tense and irritable, you just feel like your life is out of sorts, and you had a traumatic experience, like you were deployed to Iraq or Afghanistan, or you're a cop or firefighter who is at the World Trade Center or burned, or you're in a car accident, and your life just isn't the same, we would really recommend that you come in and work with one of our clinicians for an assessment.
When someone comes in for treatment, the very first thing we do is an initial assessment where we try to get a really full picture of both what happened to them and how it's impacting them, regardless of what type of trauma they experienced.
It's not uncommon for people to have misconceptions about what a clinical trial is. That sounds very cold and impersonal. But in fact, if you walk through the door and ask to be considered for a clinical trial, you're going to get a first-rate assessment of your problem by a dedicated team of clinicians and scientists, doctors and staff who will look at what's going on with you, help you determine if this research study is appropriate for you, and if it is, you can be assured that you're going to have a dedicated group of people taking care of you, and we'll do everything that we can to help you get your life back.